Medical workers tell CBS News they're worried they can't fight the coronavirus safely right now. There's a shortage of many essential supplies. Some healthcare workers have already been infected, including at least 2 doctors who are now in critical condition. We spoke to some doctors fighting the disease on the front lines.
I think we forget that physicians and nurses and healthcare professionals are human too. We walk to the bedside like we always do, but now we are knowing that we are not protected and we're facing our own death.
I'll be honest, we cry about this, right? We're concerned, we're scared, but we know what we have to do, and we want to be a part of the solution.
The fact that we don't have the right protective gear to handle these patients makes me know that I am at risk. And I know this because I do respect the virus, I respect the disease, but I also respect my colleagues. And I see that my colleagues are getting ill. And there are 2 right now that are on ventilator support. And that makes me very, very worried, especially because I have a family just like they do.
We have to get personal protective equipment, because we're going to lose our workforce if we don't. And our workforce is going to expose everyone who comes in, because we'll have it and we'll spread it before we know we have it.
It's scary. You're afraid that you're not doing enough at work for your patients, and then you feel that you come home and you haven't done enough at home.
We're all experiencing the same fear. We want to protect our patients, we want to protect our children, but we don't have the support, we don't have the means, we don't have the resources. And so this is our plea for help.
2 of the most precious human beings in my life, my mother-in-law and my son, may also face potentially life-threatening consequences because of my decision to stay at my post, to stand on that wall and protect my patients to the best of my ability. You know, as a parent, it's such a struggle to reconcile my professional duties and obligations with the fact that those very duties and obligations could hurt him.
Boy, that was very powerful. Our Dr. Tara Narula joins us now with more on this story. You know, Tara, it's so hard to hear the doctors say that they're scared and that they're afraid. We all understand that feeling, but it's very unsettling. You've been talking to doctors. What are they saying to you about their experiences?
I mean, Gail, this was just the tip of the iceberg of the overwhelming response that we got. And it really, as a colleague, it was heartbreaking to hear. These are individuals who sacrifice their life for others. They take an oath, and they're telling me that they feel like they're in a war and they don't have the armor they need. They are using words like scared, in despair, powerless, like they're sacrificial lambs. And essentially, they're screaming out to be heard and to be helped. One of the biggest issues you heard was the lack of personal protective equipment. They don't have it. They're being asked to reuse things, use them all day. They're going out on their own, spending their own money to find it. You know, somebody said it's like being a fireman and running into a burning building with flip-flops and a bikini on. This is how they feel. They need help. Another issue is that they are afraid for their own health, for their family's health, saying, I signed up for this job. My family did not sign up to take this risk. They're building makeshift places to stay at home in the garage. They don't infect their family. So here are people who are physically and psychologically on the front lines, who are coming home and can't even get that loving support from their family because they can't touch them. They're saying that they are being asked to continue to do elective surgical cases, which the government has come out and said we really should be avoiding. And many of the doctors who themselves are either pregnant or immune compromised have not received guidance about whether they should really still be working in the workforce. It's a big, big crisis right now.
Tara, the American Medical Association in a letter to the vice president asked for something akin to a Manhattan Project kind of program to expand manufacturing capacity so we could produce the supplies that doctors need. But also there's an issue of training. Are our medical staff basically trained to deal with something like this?
Well, I don't know that we're psychologically trained, and we may see those effects down the line, but we know how to take care of patients. I don't think the training is the issue. The issue is that we don't have the supplies, and we're going to lose our workforce, as you heard. You know, if our healthcare providers start to go down, start to get sick, who is going to take care of the rest of us? We know that our healthcare providers are now being self-quarantined. Many are being isolated. Many are having to stay home to take care of their own kids who are out of school. And so we really need a plan in place. And it's a big systemic issue, too. You know, the more patients we're getting in the ICU beds that we're either ruling in or out for COVID or treating, we're not able to take care of patients with other critical illnesses. So this is a big, big issue for the whole system.
Yeah, so Dr. Narula, quickly, one last question here. We've been talking about the number of hospital beds. If those are increased, do we have the workforce to staff them?
Well, that's exactly what we were just saying. I think it remains to be seen. I think if we don't protect our healthcare practitioners on the front line, and I want to be clear, this isn't just doctors, this is nurses, nurse practitioners, PAs. If we do not give them the proper protective equipment, we will lose them.
All right, Dr. Narula.
And that will be our fault. That'll be a tragedy.
And a tragedy we hope we can avoid. Dr. Narula, thank you very much.